Okay, well, welcome everyone to the Sati Center's Buddhist speaker series or Buddhist chaplaincy speaker series. And today we're delighted to welcome the Reverend Alice Cabotaje. And I'll just tell you a little bit about Alice before I hand it over to her. So the Reverend Alice Cabotaje is the Director of Spiritual Care at Stanford Healthcare. Alice is a certified educator from the Association for Clinical Pastoral Education and a board-certified chaplain through the Association of Professional Chaplains. Prior to Stanford Healthcare, Alice was Director of Spiritual Care and Education at Massachusetts General Hospital in Boston. Before Mass General, she was at the University of California, San Francisco Medical Center, where she served as a chaplain and underwent supervisory education to become an ACPE certified educator of clinical pastoral education. She is an ordained minister with the Metropolitan Community Church and an authorized Zen teacher and Dharma heir in the Rinzai Zen School Empty Cloud lineage. She has a Master of Divinity from the Pacific School of Religion, Graduate Theological Union, Berkeley, and a Bachelor of Arts in Philosophy from the University of the Philippines. Prior to her move into healthcare leadership and chaplaincy, she was a financial journalist for 20 years and covered the economies and capital markets of Asia and North and South America. So, yep, we're delighted to have you with us today, Alice, and I'm going to pass it over to you. Thanks so much.
Thank you, Jim, and also Vanessa, for this opportunity to be here with you. And I am so delighted to see many of you joining today to, listen and reflect on Koan, spiritual care as Koan, formation and embodiment. So as oftentimes, before I start the talk, I invite everyone to take a few minutes of silence. I will ring the bell 3 times and invite us to come to our bodies, to be where we are right now. Let's listen to the sound of the bell, the rising of the sound, the disappearing of the sound, all the sounds surrounding us. And as we listen, let us simply be here. There is nothing to achieve. Let's simply be here. For those whose eyes are closed, I'd like to invite you to come. Open your eyes and we'll start the talk. So once again, good morning, dear friends. I see friends here, colleagues and fellow pilgrims on this path of service. this path of compassion, this path of awakening. It is both an honor and a joy to be here before you as we explore together the intersection of spiritual care and koans, a fertile meeting ground of formation and embodiment in our work as chaplains, in our work as Buddhist chaplains, in our work as providers of spiritual care in one way or another. So I once again would like to invite you to settle in, to let body and heart-mind drop into this very moment, and to meet the words and silence of our time together, not as formation, rather as a koan in itself, a space where knowing and not knowing can dance, where wisdom and wonder can arise. My talk has 4 parts. So the first part is koan as a path of formation. Part 2 would be koan as an embodiment of spiritual care. Part 3, spiritual care as koan, a tool for awakening. And part 4 will be all of us reflecting on this and my receiving questions and all of us being in conversation. So in the Zen tradition, a koan is a question, a story, or a paradox meant to pull us out of our habitual ways of thinking. It is meant to break us out of dualistic thinking. It is used in Zen practice, especially in the Rinzai sect, to provoke a direct experience of our essential nature, to awaken us to ultimate reality. Author Ruth Fuller Sasaki traced the origins of koans to the early Tang Dynasty in China, where they emerged as part of the Chan tradition. Initially, koans were records of interactions between Zen masters and their disciples, moments that encapsulated the spontaneous and direct transmission of awakening. Over time, these dialogues were formalized into tools for training and contemplation. A koan is not resolved through logic or intellect, nor verbal explanation. A koan is meant to be wrestled with, experienced, lived, and ultimately integrated and embodied in our everyday life in service to all. Let us consider this koan, Dogo's condolence visit, case number 55 in the Hegikan Roku, or the Blue Cliff Record. The koan goes, Zen Master Dogo and his student Zengen came to a house to express condolences. Zengen tapped on the coffin and said, "Is this life or is this death?" Dogo said, "I don't say life, I don't say death." Zengen said, "Why don't you?" Dogo said, "I won't say, I won't say." On the way back, Zengen said, "Master, please say it to me right away. If you don't, I shall hit you." Dogo said, "If you want to hit me, you can hit me, but I will never say." Thereupon, Zengen hit him. Sometime later, Dogo passed away. Zengen then went to Dogo's successor, Sekiso, and told him what happened. Sekiso said, "I don't say life, I don't say death." Zengen said, "Why don't you?" Sekiso said, "I won't say, I won't say." With these words, Zengen came suddenly to an insight. The question of life and death is central to our practice. In Zen monasteries and retreats, the retreatants at the close of every day chant the evening gatha, that life and death are of supreme importance, inviting all to strive to awaken to the true nature of life and death. The evening Gatha says, "Let me respectfully remind you, life and death are of supreme importance. Time swiftly passes by and opportunity is lost. Each of us should strive to awaken. Awaken, take heed, do not squander your life." For those of us who work in hospitals and hospices, we face the question and reality of life and death repeatedly, constantly. My Zen teacher, Greg Myers, gave me this koan when I started work as a hospice chaplain in 2008. I immersed myself in it for 6 months, and I was beginning to get frustrated because I just couldn't get through it. What is life? What is death? One morning, a nurse called me to visit a patient who was dying. I sat with the patient, and as I sat there, I matched my breathing with their breathing. After 30 minutes of sitting with them, the koan suddenly opened up. Wow, ah, like I was speechless for the whole day. Formation as a chaplain is a koan. For many or some of us, when we enter this path of spiritual care, perhaps we thought, I will learn to ease suffering, offer comfort, and be a presence of peace. Really noble intentions. And yet, what we may have discovered is that spiritual care is not neat. It is not linear, and certainly it is not comfortable. It is messy. A dying patient says, "Why is this happening to me?" A grieving family asks, "Where is God in this?" A colleague snaps at us, exhausted by their own burdens. What do we do? What do we say? In these moments, these questions, these situations become a koan. And as we sit with it, as we wrestle with it, as we immerse ourselves in it, we become the koan. We are the question and the answer, the paradox and the breakthrough. Returning to Dogo's condolence visit, Case 55 in the Hegikan Roku or the Blue Cliff Record, Zengen begged Master Dogo and said, "Master, please say it to me right away. If you don't, I shall hit you." Zengen was desperate to know the answer. And Dogo said, "I won't say. I won't say." He didn't say, "I can't say." He didn't say, "I don't know." He didn't say, "Go away." He didn't say, "I forgot." He said, "I won't say. I won't say." For one, he wanted Zengen to realize it himself. At the same time, what was Dogo pointing to? This koan essentially asks us to look into our own birth and life, to come face to face with our own death and dying. In koan as formation, the first step always in koan practice is often described as not knowing. We approach the koan with a beginner's mind, relinquishing preconceived notions. In spiritual care, this is the practice of dropping our certainties about ourselves, our beliefs about others, and even suffering itself. To meet another's suffering, we are invited to surrender our need to fix, to rescue, to solve, or to have all the answers. Formation begins not with mastery. It begins with humility, with openness, with curiosity. When a patient asks, "Why is this happening to me?" perhaps the most appropriate response is to sit with them in equanimity and then explore and embody the question with them. Soto Zen Master Dogen said, "To study the Buddha is to study the self. To study the self is to forget the self. To forget the self is to be actualized by all things." Again, to study the Buddha way is to study the self. To study the self is to forget the self. To forget the self is to be actualized by all things. As chaplains, as those of us who provide spiritual care, our formation is not simply and not merely about learning the art and skill of spiritual care. It is not merely about integrating theories into our practice. It is not merely engaging in reflection, drawing on our own religion, spiritual practice, philosophy, and worldview. Rather, it is a stripping away of our need for control. It is allowing the suffering we encounter to turn the light inward, illuminating our own shadows, our attachments, our fears. Have you noticed how those we serve are often our greatest teachers? Their questions, their struggles, their silences, they are the koans that shape us, calling forth for authenticity and truly being, and being with moment by moment, in between moments. So it's truly being and being here, moment by moment, and in between moments. If formation is about becoming the koan, embodiment of a koan is about living it. In Zen, we often say the true resolution of a koan is not in words, but in action. How does this apply to spiritual care? Well, as we know in spiritual care, there are no fixed answers. In the same way, no koan has a fixed answer. The answer is more of you, the person that you become. When you walk into a hospital room, your very being speaks. Before a single word is uttered, your embodied practice, your stillness, your openness, your humility, your grounded state communicates everything that needs to be said. In another koan, ordinary mind is the way, which is case 19 in the Mumongkan or Gateless Gate, Joshu earnestly asked his teacher Nansen, "What is the way?" Nansen answered, "Ordinary mind is the way." Joshu asked, "Should I direct myself toward it or not?" Nansen said, "If you try to turn toward it, you go against it." Joshu asked, "If I do not try to turn toward it, how can I know that it is the way?" Nansen answered, "The way does not belong to knowing or not knowing. Knowing is delusion. Not knowing is a blank consciousness. When you have really reached the true way beyond all doubt, you will find it as vast and boundless as the great empty sky. How can it be talked about on a level of right and wrong?" At these words, Joshu was suddenly enlightened. What is ordinary mind? Ordinary mind is an undefiled mind. It is mirror-like, reflecting anything and everything that is placed before it just as it is. No more, no less. In spiritual care, there is an element of immediacy when living out ordinary mind. We do what is required here and now, with swiftness, with naturalness, and with our full attention. There is no argument. There is no rationalizing. There is no resistance to the present situation. There is no wishing for something else other than what is unfolding. In spiritual care, ordinary mind also translates to being the fruit of one's practice. That is, being aware, unpretentious, and profoundly attentive. It is not about performing. It is about being a vessel through which service flows, through which loving kindness flows, through which compassion flows. As many of us know, one of the challenges of spiritual care is bearing witness to immense suffering without being overwhelmed. In Zen, we practice equanimity, not as detachment, rather as the ability to hold space for the full catastrophe of life while remaining rooted. When a patient lashes out in anger or fear, we meet them with compassion, and we try to meet them without taking their anger and fear personally. When we sit with someone who is dying, we can stay present, and we try not to cling to outcomes. This is the embodiment of the Koan. It requires both a tender heart and a steady and clear mind. It requires being with only this, just this. Returning to the Koan Dogo's condolence visit, case 55 in the Hekigan Roku, this Koan also invites us to sit with all that is happening, especially with our feelings, which is vital in being a skillful chaplain. This koan calls us to sit with our losses and our grief, which includes our sadness, our anger, our shock, our frustrations, our sense of isolation, our dashed hopes, our loneliness, our regrets, our longings, our memories, our fears, our pain. It also asks us to sit with our joy, our gladness, our celebration, and appreciation for life. It encourages us to be with our sadness, only our sadness, our joy, only our joy, our anger, only our anger, our gratitude, only our gratitude, our shock, only our shock, our awe, only our awe, our frustration, only our frustration, our delight, only our delight, our sense of isolation, only our sense of isolation, our pleasures, only our pleasures, our dashed hopes, only our dashed hopes, our success, only our success, our loneliness, only our loneliness, our regrets, only our regrets, our longings, only our longings, our fears, only our fears, our pain, only our pain. Japanese poet Sagyo wrote, open and close quotes, detached observer of blossoms, finding himself in time, intimate with them. So when they separate from the branch, it is he who falls deeply into grief. Detached observer of blossoms finds himself in time, intimate with them. So when they separate from the branch, it is he who falls deeply into grief. As we sit with all the feelings that arise, we are invited to stop running away when a situation hurts, to stop from sweetening things up, to stop smoothing things over, to stop from wanting something different to what is happening here, right now. Only this, just this, only this, just this. The beauty with only this, just this, is when we give it our time and full attention, something opens up that surprises us. Finally, I want us to consider this. Spiritual care is not merely a profession or a role. It is a spiritual practice, a path of awakening. Every interaction, every encounter we have is an invitation to deepen our connection to the Dharma, to embody compassion, and to realize our essential nature. When we sit with a patient who is dying, we too face our own impermanence. Japanese Zen Buddhist monk and poet Ikkyu Zojun wrote, "The moon is a house in which the mind is master. Look very closely. Only impermanence lasts. The floating world, too, will pass." The moon is a house in which the mind is master. Look very closely. Only impermanence lasts. The floating world, too, will pass. When we hold space for a family's grief, or for anyone who comes to us sad and grieving, we too hold space for the sorrow of all beings. When we offer kindness to a stranger, to someone, to a pet, to a situation, we offer boundless bodhicitta. As I end this talk, I invite you to reflect on this. How do we serve others while awakening ourselves? How do we offer spiritual care without falling into dualism, without seeing us as healer and them as the ones needing healing? Also, what koan is shaping you right now? Is it a question, a relationship, a challenge, or a mystery? Whatever it is, I encourage you to wrestle with it, to marinate into it fully, to let it teach you, and to let it awaken you. May we, as chaplains, as providers of spiritual care, continue to embody the practice of being, the practice of compassion, the practice of full attention and awareness in all that we do. And may our lives become a living koan, offering not answers, rather offering an opening to that loving, liberating vastness we are all in. Finally, let me ask you, is this life or is this death? For those of you who would like to work on this koan, may you break through this koan and experience true freedom and the boundlessness of all. Thank you. Gosh.
Well, thank you, Alice. That was beautiful, a beautiful talk. And would it be okay now to invite questions from the folks here?
Yes, yes. And if you
Okay.
have your own reflections around this as well, I invite you to share it. And this is one of the best ways we can learn, sharing, drawing from the wisdom of everyone. And at the same time, any questions? And I'd like this to be a dialogue, a conversation.
Maybe if you're able to, raising a Zoom hand is always good just to kind of keep things a bit more organized. But if that's tricky or confusing, you can try your physical hand, but we do have enough for 2 pages of faces, so we may not see all the physical hands.
Okay, I have a question here from Paul Fulmer, staff chaplain at Stanford Healthcare, one of my colleagues. And he says, Alice, you mentioned reflecting on a koan over the course of 6 months during your time in hospice. What practices, actions did you take? How might we keep a koan alive and active over an extended amount of time? Well, what I can say, Paul, I mean, that's one of the practices of in koan study. It's like it has to be a relentless thing, like every day for me, every moment while I'm walking, like, is this life or is this death? While I'm washing my clothes, while I'm washing dishes, while I'm sweeping the floor. I mean, of course, not when I'm in conversation with others. When I take a walk, when I take a shower, like until it opens up, until a breakthrough happens, it's something that I constantly am in until I become the koan becomes me. And sometimes with koan study, it requires a level of frustration and desperation to break through. Sometimes it takes years. And sometimes for others, it can just take like a koan, like in koan study, and suddenly it just comes up. So it really varies. And there are koans, like in my case, there are koans that hook me, and there are koans that, yeah, okay. But there are koans that affect me in a most profound way. So yes, it's always literally at the back of one's mind. Yes, Jim.
Yeah, I have a question. So I also did Koan study with my teacher in the Zen tradition. And as you say, sometimes it takes a while to work with a particular koan, right? And
Mhm.
you often work with it during zazen, you're working with it off the cushion,
Mhm.
and it's a process. And then when you're going for, dokusan, then when the time's right, then, the presentation is enough to pass.
Mhm.
Um, and there is a lot of time often to work with that koan. The teacher doesn't necessarily expect an immediate response. And I would say that in healthcare, maybe you don't always have that degree of time. And what came to me was the koan, when someone asked Uman, what was the lifetime teaching of the Buddha? And he said, an appropriate response.
Can
And
you say
there's
that again, Jim? Can you say that koan again?
sure, sure. What is the lifetime teaching of the Buddha? And
Mhm.
Uman said, an appropriate response,
Mhm.
which for me always has this sense of immediacy, of timeliness, of being able to meet that moment fully. And so my experience of working with koans is often the luxury of time. And in healthcare, there's not always that case, whether it's being with a patient, whether it's a bioethical issue that's kind of emergent. So I just wanted to hear some of your thoughts about maybe those different time frames, or if there's something about the spirit of koan, of kind of sitting with that uncertainty and of trusting that you can meet that moment that is maybe more important. But
Mhm.
I was just curious to hear your thoughts on that sense of time frame and urgency.
Yes. So the way I see it, especially when one practices trying to be aware, being here, being present. And of course in Zen practice, like one sin is hesitation. Like when, for me, for instance, when I go to my teacher and present a koan, like the moment I hesitate and the thinking comes, it's like, okay, leave, continue to work on your koan. And in the same way in spiritual care, and that's especially for those who go through CPE or chaplaincy training, one of the things is, again, that awareness of where we're at. It's a process of also knowing our biases, our assumptions, everything that's going on. We're taught to be aware of what's happening in the room. We're taught to be aware, to read the room, to what may be going on with the person. It's a sensitivity to everything that happens. And as we continue to practice us, and there are also theories that we use to assess, to make a spiritual care assessment. And as we learn more and more, we get to the point where it becomes second nature. And when a situation arises, sometimes the appropriate response and trusting, what arises, may be to say, I don't know. Or maybe to say, let me find out. Or it may be a word. It may be smiling. It may be a song. And sometimes we're not perfect. It may not be the appropriate response. And even that is, being aware of that is appropriate in itself. So I think it's having more the spirit of embracing whatever comes up and trusting that somehow, it works out. And if it does not, like in CPE, we ask ourselves, reflect, okay, how would I do it differently next time? What would be a more or another or a more appropriate answer? And that, would be, once again, responding in the immediacy. So it's no second guessing and just trying to come forth.
And that action reflection model, I mean, that's quite similar to working
Exactly.
with a teacher with Koan study, where maybe you go in a number of times and your presentation doesn't cut it, and you go back out to work on it again, and that process is actually quite similar.
Exactly. Yeah. Parallel. That's the parallel process. Yes, you're right. You're right, Jim.
And
yes, and being willing, in going through chaplaincy training, the willingness as well to be embarrassed, to not know, and trying again and again, that requires humility, that requires surrender, that requires letting go of many things, unsheathing or taking off, our defenses. And in the same way, in Koan study, that's the same thing, like trying each time and being thrown out of the room or being asked to leave or being saying, no, it's not that, And it develops, a sense of persistence, of dedication, of passion, for the study. In the same way, in spiritual care, I mean, I'm in spiritual care because I not only love it, I am passionate about it. Okay, so I have questions. Okay, a question from Sam. Sam and I worked together. He was a CPE student over at in one summer in 2017 at Mass General Hospital, right, Sam? Yeah, and I was his educator.
2019. How the years?
2019. Sorry about that. So yes, so Sam asks, would you please elaborate on what you mean by only this? Often with patients ourselves, there are multiple feelings. Are you suggesting that we are present to these one by one? Great question, Sam. I mean, of course, like when multiple feelings come up, it's being able to sit with all of those. Yes. And so even that, sitting with only all these feelings, only all of these things that come forth, only that. And then when I was talking about only anger, only, like it's more of one's personal practice. When you're feeling anything and anger arises, only like being being willing to not only acknowledge and recognize that, being willing to just like stay and sit with it. And then when it's joy, being willing to stay and sit with it. It's like we don't rush through things. In the same way in spiritual care, you know, when the person is like complaining about certain things, we stay with that and not try to like, okay, can we move on to the next? It's being able to be there, you know, whether it's long or short. And as you know, Sam, I think though I use the word tracking, being able to track where the patient is at, tracking as well where you're at, you know, as you engage during the encounter. And then in Zen practice, this practice of only this, just this, it's a practice to invite oneself to be wholly here in the moment, nothing else, only this. And in being that, I mean, for me, it opens up, you know, to all this as well. Yeah.
Thank you.
Okay. Okay, I have a question from Bruce. Is this question I have been living for the last few years a koan? What is this alivening in me that is yearning to be revealed and lived? Yes, Bruce. Yes, you know, that's that constant surge, that constant longing and yearning. What is this? Like I remember, I think for me, the first koan I had was when I asked myself at 14, who am I? Who am I? What am I here for? That was a koan. And for decades, I wrestled, you know, with that. Yes, you know, because Bruce, as you ask this question over and over in your waking time, in your prayer and all of that, this relentless asking or bringing that up somehow will bring some breakthroughs in many ways, different levels. So yes, it is a koan.
Thank you, Alice. And it's a question I not only ask, but it like arises in me. It's like a real living question. It's not something, you know, it's a question that came to me. It becomes me. I guess that's is that part of what you're also, I guess that's part of what you're saying too.
Yes.
Koan is.
Yes, and hopefully as it becomes you and you become it, you know, I don't know, just see where it takes you.
Yeah.
And
Thank
see
you.
what opens up. Yes.
Yes, this is a masterful talk. Beautiful. Thank you.
Thank you, Bruce. Are there other questions or any reflections or experiences that you'd like to share?
Margaret
Alice?
has her hand up.
Alice, this is
Oh,
Margaret
hi,
Gaynor.
Margaret. Yeah,
Hi.
Margaret is a co-sitter. We sit together with the Mercy Center East-West group. Great to see you, Margaret.
Thank you. Some years ago, I took this chaplaincy class, and I served as a jail chaplain, which is very different from hospital chaplain. But over 15 years of service there, what I am looking back on is how the line you said, impermanence is the only lasting thing. I changed a lot from beginning to end. My first days in jail, I was very goal oriented. I wanted people to learn the meditations I was teaching. And by the end, I understood very clearly many of the things you're saying. Just being there was what was needed and what served. And, you know, going every week for 15 years, I looked forward to it and I was afraid of it because of how changed I became over those visits. There were things to be afraid of and things to be challenged by and things to be thrilled about. And the incarcerated people taught me my practice during those years. I'm not doing it now. I actually still miss it, but it still is teaching me. So this is a lifelong, as you said, it's a passionate way of life. And I cannot think of anything that served me better than that. Thank you.
Thank you. Thank you, Margaret. And I'd like to go back again to Sam's question about, only this. In terms of spiritual care, it also is a practice of being able to fully delve deeply into what we're feeling. Not to run away, to truly get into it. And as I share with students whom I've educated and supervised, I say that we can only go so far with a patient, with the depths of their anger or their fears, or their fears or their frustrations or their loneliness and longings, and also can only go so far in terms of the heights of their joy. We can only do any of those things if we can do that with ourselves. So we are not able to accompany them in the heights of what they feel or the depths of what they feel if we can't do that with ourselves.
Alice, if I may, just another thought.
Sure. Yes.
So I loved when you brought up the koan with Dogo and Zengen, and thinking about that in the context of chaplaincy, this idea of I won't say. So even though Dogo was a teacher in that setup, he was kind of accompanying. They were almost like spiritual friends. They were walking together. They went to this funeral together. He even let him hit him. Like it was a very unusual dynamic.
Mm-hmm.
And the role of chaplain is one that accompanies, not one that leads.
Mm-hmm.
And in the same way that it can be very tempting in a situation where a patient may be wrestling with something, to kind of give your own advice, to give your own perspective, there's that real kind of sense of wanting to fix or wanting to get in there and do something. But instead, the kind of compassion of Dogo
Mm-hmm.
to hold back. And as you said, like he wanted Zengen to wrestle with this himself, right? And in the same way with the patient, that if we kind of put too much of ourselves into the mix, we're kind of muddying the waters. We're not giving them the space to really work through what they need to work through. So I kind of appreciated the way that, this relationship between Dogo and Zengen kind of modeled the relationship of a chaplain accompanying someone who's working with these kind of deep spiritual questions.
Yes, well said, Jim. And this brings to mind, and you may be aware of this, the something that it's a guide, that Dr. Alan Wolfett has written on companioning, and it encapsulates what you said. If I'll send it to you if you wish. Yeah, if you don't have it, sure. Claire.
Hello, thank you so much. That was fantastic. I'm doing the course at the moment with Vanessa online, actually.
Mm-hmm.
And, I've just been writing down lots of things when you've been speaking, but there's the only this that you were sort of talking more about again there when Sam asked, and this idea of equanimity. And the word that was coming up for me, because it all sounds quite calm, but actually the fearlessness that is needed to stay in that, it really struck me how fearless, what sort of courage it takes in a way to not interfere and not, that's the word that was coming. And this idea of, I'm a Soto Zen student, and the not grasping and not pushing away, and how simple all these little phrases sound, but actually the ask of it. And it was lovely listening to Margaret talk about her experiences and just thinking of the ask of that.
Mm-hmm.
Just something I was thinking of.
Yes. Thank you. Thank you for sharing, Claire. Marvelous. Yeah. Because it really can get scary, especially when the stuff, that don't look pretty, the stuff that show us our shadow, the stuff that brings up shame and rejection of ourselves. And yeah, it takes courage. Like one of the stories that I that remind me about being willing to embrace all that I am, including the things that I'm ashamed of, that I reject. There's this story by Milarepa, and Milarepa was like, would sit for days. I mean, he really had an intense sitting practice, and he lived in a cave. And one day, he went out to gather firewood, and he went in. And when he got there, he saw all of these demons, like eating his food, reading his books, sitting on his cushion, like being in his cave. And so he looked at them and he said, wow. So what should I do? So what he decided was, he sat on his cushion, his teaching cushion, and he started teaching them the Dharma. And, the demons just yawned like, yeah. And then later on he said, okay, eat my food, read my books, sleep on my bed, stay as long as you want. I'm fine with it. And then they left. They got up and left. And there was one who stayed behind. And, Milarepa looked at this demon and said, oh dear, this is a really, really tough one. And then later on, he said, he approached the demon, opened this demon's mouth and said, eat me, take me. If that is what it needs, I am fine. And he surrendered himself completely to that demon, and that demon disappeared. So, yeah.
Well, Alice, we just hit the top of the hour. So thank you again for such an amazing presentation, really bringing the Koan tradition into life in the spiritual care context. It was quite remarkable. I've just shared in the chat the link to donate to the speaker series. If anyone should feel so moved, we very much appreciate any support to continue with these valuable talks. And next month we have Kevin Griffin joining us, talking on the nature of suffering, addiction, and the Four Truths. And that will be on December 7th. So right now I'm going to ask any current or past Sati chaplaincy students to stay on the call, and we'll say goodbye to everyone else. Thank you.